Welcome. My name is Shelley Stein. I serve as the chair of Genesee County Legislature, and it's a great honor and pleasure today to welcome our Lieutenant Governor, Kathy Hochul, with the State of the State presentation. We're thrilled today to have our Lieutenant Governor present to our highly resilient county. We in Genesee are good friends and longtime friends working together in securing a bright and robust economic future. And we welcome that partnership and focus. Before we can step ahead, our recovered public health is necessary. Rural counties such as Genesee require the additional dose allocation to ensure our complete health recovery. Thank you ahead of nudging or providing doses on behalf of our rural counties. I am joined by our legislators in chamber today, and we are anxious to learn about the state resources that support state services delivered by our county dollars and the impacts of other actions of maintenance of efforts in the state budgets. So please welcome with me our Lieutenant Governor, Kathy Hochul. Thank you.
Well, thank you, Chairwoman Stein. It was great. We had a wonderful visit to Batavia just a few months ago, I think maybe in October or so, and had a chance to do some amazing things and reconnect with my friends in Genesee County. So thank you for the introduction and your partnership with us. I know that we have Steve Hyde on the call again, our GCEDC chair and our president, and I want to thank him for his many years of support for myself, but also for the governor's initiatives as we try to bring more money and more dollars and more projects to Genesee County. I think Tom Turnbull, our chamber president, may be on the call as well, and Rachel Tabelski, our manager, and as well as the county legislator members. We did have a very good conversation a couple months back to talk about some of the really exciting projects that are going on in Genesee County, and I will get to them in 1 second, but just in terms of some announcements from the governor just on the press call a couple of hours ago, he did say that places like a Darien Lake can open for outdoor entertainment April 9th at 33% capacity. So I know there was a lot of anxiety about whether or not we're going to be having outdoor parks open up like that, and we will be able to April 9th. Indoor family entertainment venues can open on March 26th at 25% capacity. I just want to officially get that out there. But yeah, there are a lot of great things going on in the county. I was actually out there for the opening of the Western New York National Cemetery dedication, where a lot of high-ranking officials from Washington came in, but this is something we had talked about my entire time in Congress, and Senator Schumer was a driving force behind that, as well as many local people. Many of our local veterans worked so hard to make that happen. So that was something that we're very proud of to have in Genesee County as well. And I did have a chance to go visit the Noble Farm this summer to talk about the stress that a lot of our farmers are under. And we're so grateful that we could continue the Nourish New York program to help places like that, people that are used to providing to schools and to restaurants, and whether they're crop growers or milk dairy people, dairy women, it's been really hard. And so that program is going to continue, really important to us. The Downtown Revitalization Initiative, there was a lot of question when we started talking about the hard hit that New York State had taken as a result of battling this pandemic. Significant loss in revenues as well as extraordinary expenses. And there was questions, are we going to be able to continue the regional economic development councils? Can we continue the DRI program? And we all know, particularly in a place like Batavia, how critically important that infusion of $10 million has, which we announced back in October of 18, really just to change the whole trajectory of a community. So we're going to continue those, and that's the good news in this year's budget. It's one of the favorite things I get to do, and that's what brought me out to the area just a little while ago. We looked at Ellicott Station being worked on, Ellicott Place, working on the downtown projects, downtown building improvements, 99 Main Street. I mean, these are just, for so long, these buildings taunted us and, begged for someone to pay attention to them and give them new life. And so I'm really excited about that. Transforming City Senior Center into indoor market and performance space. That's going to be fabulous. Also, downtown intergenerational healthy living in collaboration with Rochester Regional Health. These are all great ideas to continue focusing on our downtown, where we want people to continue coming, supporting the local businesses, the restaurants, who really are still hard hit from this pandemic. Regional Performing Arts Center, again, drive people to the downtown areas, enhance Jackson Square. So much going on, but never forgetting our rural communities as well. And that's why I continue to be laser focused. In fact, the governor mentioned today that he talked to the county leaders yesterday and said, we're going to make sure that we're doing this equitably, the distribution of vaccines, and we are not going to overlook the rural areas. And that's an important area that people think is easy to overlook. But I assure you, with someone like myself who knows the rural areas very well, that that's just not going to happen. So we're going to continue Regional Economic Development Council projects, continue to focus on some of the really exciting things. And Steve and I talk about this all the time, the STAMP project, Western New York STAMP, and the potential investment that's already going to follow the existing investment. Samsung has been out in the news. I don't know if Steve's got any word inside track on that or not, but we're all weighing in to try to be, I know that's narrowed down to 5 venues, and Senator Schumer is adamant about trying to win that one too. We're very competitive. And I mentioned Senator Schumer a few times along with the support with the governor, but we are so fortunate to have him in that position of incredible influence. I just heard him speak on the Association of Towns call, I think yesterday, the day before. He preceded me and talked about all the projects. He knows our community. You know, he's at the cemetery. He walked the streets of downtown. He knows how important the STAMP Act is. And to have him as the most influential senator in Washington, it's amazing what we're going to be able to do. The agenda that the governor and I have for Washington, the senator and Senator Jill are going to be able to deliver for us. We are going to be in a whole different place. So I do want to talk about, go through the governor's initiatives in the budget, but I also going to focus, I mentioned again, I did come to Batavia to talk about a workforce development program to get more people trained in healthcare at our downtown healthcare facilities. And so let's focus on a lot of people who've not survived this pandemic, people whose businesses and jobs may not come back, which is tragic, but we can't let them fall through the cracks. We can't let them be forgotten. We have to get people retooled in different training programs. So we're going to continue working on that as well. So let me go to the slide program. And I assure you, if you've ever watched the governor's budget rollouts, I talk a lot faster than he does. It's an upstate thing. And I also know that your time is precious, so I'll kind of zip through some of these in case it's what I think you may already know. But we are very energized and excited about imagining, rebuilding, and renewing New York. This is an opportunity for us. You can say we've been kicked down, hit hard, lose your mojo, whatever you want to say. No, that's not New Yorkers. You know, regardless of whether you're from Genesee County, from Buffalo, from Rochester, anywhere you live in our region, we know how tough you have to be to have survived what we already have, the loss of our industrial base, flight, you know, people just leaving us in droves. My entire big Irish Catholic family from Buffalo all left town and left me alone here. So I know what that's like, but I also know that there has been a resurgence and we're just not going backwards. You know, places like Batavia, Genesee County are so important. So we think back, you know, it's 2020 is over. Amen, hallelujah, long time, the longest year of our lives, but now we have to have that spirit of optimism, which is really something that we don't just talk about. It's not a slogan, it's what we're going to be doing. So here's our bold action plan. Defeating COVID, we continue to make sure that we have rapid testing, that we have access to PPE. We're gonna be doing more manufacturing of that here in the state. Vaccinating New Yorkers. I will tell you, and I'm among them, this is enormously frustrating from the governor and I on down to not have enough supply to meet the demand. We're going to continue doing pop-ups when we can, some mass vaccination sites, and there will come a day, mark my words, when we will have enough supply for everyone and we'll be looking for people to vaccinate just literally within the next 6 months. And until that time, it is very frustrating for people having access problems. We're expecting people to register online and some people still don't have good broadband. And there's a lot of challenges, especially for our senior citizens. So we've had it available in, you know, you can make a reservation for an appointment on a telephone call. I know that's a long wait as well. So whatever your frustration is, we've all experienced it, but this is our goal. In order for this vaccination to be successful and protect New Yorkers so we can get back to what is the new normal, we have to hit at least 70 to 90% of people. We've hit every nursing home patient who wants it. And I think about 75% have agreed to do it. That leaves 25% who've declined. and only about 50% of nursing home workers, it's been offered to every one of them, have taken advantage of that. So we have some work to do for people we know to get vaccinated first before it goes to the general population, that there's been some hesitation, and that's something we're gonna have to overcome. The short-term economic crisis is, we'll dive into that with the money we're requesting from Washington in our budget. But also, we're not stopping our planning. That's why I wanted to reassure everyone that the DRIs will continue, that our commitments under the Regional Economic Development Councils will continue. And that's really important to note, because the easier path would have been to just say, we have to take a breather here. We can't continue these investments at this time because our state's in financial crisis. But we're not going to do that. Also, shift toward green energy. This is great for us in upstate New York. Solar, wind, geothermal. There's so many opportunities for us to be investing in this and creating new jobs, and a lot going on with the stamp plant, with the stamp area as well. Also, there's a lot of changes that we've seen in our society, and are there some good benefits coming out of this in terms of, is it better now that people can work from home? Yes, I think it does. I think that gives us an opportunity to encourage people from other parts of the country or the more densely populated parts of our state, New York City. I talked about this when I was in Batavia a few months ago. We have a campaign that says, promotes our quality of life, our cost of living, our housing stock, the charm of our downtowns, how you get to know all your neighbors, and you can work remotely for an employer in Midtown Manhattan. This could be a transformative time for us to let people know how wonderful it is to live in our upstate communities as well. Also, the systemic injustices that have been revealed through COVID, we need to continue to address those. So I mentioned we need to vaccinate a lot more New Yorkers. We need to make sure that we have social and racial justice to overcome the barriers and make sure, Blacks, Latinos, Asians, Native Americans, rural, and the poor have access to the vaccine. And I'm going to focus on rural and poor right here, particularly because that's what we're experiencing in a lot of our upstate counties, that people are just feeling they don't have access. There will come a time where anyone, just like a flu shot, can walk into a local pharmacy and get it. But we have to prioritize right now with the limited doses we have and make sure that we continue to get our essential workers and people who are exposed and individuals over the age of 65. Now we're also adding people with underlying health conditions. So just to give you some numbers on what we're dealing with, at first, our first pool of people was about 2.1 million. Then it went to, that was essential workers and nursing homes. Then it went to 5 million. Then it went to 7 million with the people over 65, not just 75, but 65. And when you add in people with underlying health conditions, we now have 10 million New Yorkers eligible for the vaccine. And our supply went up from 250,000 a week to 300,000 a week. So at that rate, it's going to take a long time. But the good news is that we have the infrastructure in place. We have the pharmacies ready. We have the healthcare facilities, the doctor's offices, the local public health entities are working with us on what they can help us with as well. This is all there. We'll have plenty of staff, plenty of locations, and a message to get out there as soon as we have a supply. We literally could do the entire state of New York population in a month or less with the capacity we've established. So people should take comfort in the fact that a year ago, if you had told us we'd have a vaccine in people's arms, over 2 million New Yorkers already vaccinated now, we would have said, you're dreaming, because it takes 18 months to 2 years to even create a vaccine. This was done in lightning time, lightning speed, and we now have it available to us literally 1 year after this pandemic started, and we're starting to get more doses coming into our state. I'm sorry, I skipped the last one. We need to have more public health officials. On the last slide, it mentioned we're having a program to train more people, also a training program for our citizens. We need more people. We need more volunteers. We're going to need more people at our vaccination sites eventually when we have the supply. So we're going to be training people and giving them certification to do that. We talk about telehealth, and this goes under the category of improvements, not just being able to work from home, but able to get access to good quality health care. When I was a member of Congress and very proud to represent your community, your county, I was on the Armed Services Committee, and I had a chance to work with a lot of our veterans groups in Genesee County. I went to a lot of the meetings. And what I realized was there were a lot of people not taking advantage of healthcare from the VA, and particularly those who are recently returning from Iraq or Afghanistan. They went back to their homes on the farm or their small towns and just kind of fell between the cracks. They may have been suffering from PTSD or had other health challenges. And I said, why can't we just have telehealth services? You know, we've already developed them. I saw it in Rochester. We'd already developed the capacity to do this, and the insurance companies didn't cover it. So I have always had in my mind that our rural communities are really healthcare deserts for so many people who don't want to travel a great distance just to get checked on their diabetes or their heart condition, their blood pressure. So with telehealth, now as a result of the pandemic, the insurance coverage is there. We can make people be able to connect with their doctors, a healthcare professional. And I do believe that whether it's for mental health, substance abuse, I'm always trying to expand our access to substance abuse treatment and therapies and people to talk to. We can do this now through telehealth. So I think for a county like Genesee, this is a dramatic improvement. We also have to realize what we went through last spring was unconscionable, that the greatest nation on this planet had to scramble and go all the way to China and pay extraordinary prices for something as simple as a mask or a gown or ventilators. And so we are being very focused on prioritizing buying American-made PE, but also manufacturers in New York that have had a different line of work. We need them to retool even now. This isn't over. We need to continue to stockpile our PPE and make sure that it's available. When you see the vaccination sites, and I visited the one in Henrietta not that long ago, and I've traveled all over the state, we go through a lot of PPE even at the vaccination site. So we're going to continue manufacturing that right here in our state. So we're working with companies right here in the Finger Lakes to do that. And I also had mentioned early on our economic crisis, $15 billion hole. Can't do it alone, no way it can happen. So we want Washington to treat this like any other natural disaster, a hurricane, a flood. Washington needs to cover the cost for us. And here's our options. Worst case scenario, we only get $6 billion. The other one, we get fair funding, which we think is about, which we know is about 15 billion. Worst case doomsday scenario, we have to find the 9 billion. I don't even want to say these words because we don't want to do this. Tax increases, cuts to schools, healthcare, social services. If we get what we believe we are due after having to deal with these extraordinary circumstances, we'll be able to cover our full agenda for healthcare, continue opening affordable housing projects in Genesee County, childcare, which is a disaster for families, labor agreements, and education. We also figure that we should be asking, and Senator Schumer understands how important this is, repeal the cap on state and local taxes, which New Yorkers are spending, costing you. This isn't for the state. This is what money should be back in New Yorkers' pockets when they used to be able to deduct what they paid in state and local taxes. And that was eliminated 3 years ago under a so-called tax reform. So with the Finger Lakes regions, 75,000 people have had to pay more, an average of $2,600 per home. Here's something that I know has been controversial, but let me explain why time has come. Basically, we are surrounded by states now where adult use cannabis is legal and readily available. You go to places like Ontario, it's already been available for a long time. It'll be legal in Pennsylvania. New Jersey's right there. Connecticut and Massachusetts, you go in the parking lots of these facilities, and I'm told you'll see mostly New York State cars. So the activity is already ongoing. We want to make sure that we regulate it, we tax it, and we make sure that it's properly legalized. And in addition to that, there's tremendous revenue gains that are right now in the black market that we think would be, we know would be very helpful to New York State, generating around $350 million annually. Some experts say that that's low, but we just don't know yet. And having a $100 million social equity fund. Also, we're losing money to other states because we don't have legal mobile sports betting. You see people from New York State going to other states and making their bets on New York State teams, and the revenues is not coming here, so we want to help raise more money through that. The way we're going to get people into downtown, whether it's offices, venues, the theaters, the restaurants, we want people to feel comfortable that the people in the building, in the facility, in the restaurant have been tested, test negative, or can confirm that they've been vaccinated. So we're going to be reopening facilities with that available to them. It's going to take a lot to roll it out, but that's part of our priorities to return to some sense of normal. Pop-up activities, we're going to be launching creative artists, injecting money into restaurants and arts and tourism, which are important, whether it's New York City, whether it's up in Genesee County. Also recognizing that a lot of people, to no fault of their own, lost their jobs. Don't get what they once made in unemployment coverage. And I had some numbers on our unemployment rates here in Genesee County, and they're still quite high. Unemployment figure rates was about 6%. Genesee County is 5.4%. It's down from what it had been. It had been down almost 15% in April, but we've been lower than that a year ago. So that means there's still people out there looking for work, not able to make their mortgage payments, not able to help pay for their rent. And also the businesses restaurants who've been shut down, how do they pay their rent for their commercial landlords? So we're trying to eliminate the fees and penalties for that. Also, as part of our green energy economy, we're going to be building out a lot more. Jobs are going to be created, spur investment, and also make us energy independent and focus on renewables. That's wind, solar, hydroelectric power across the state. 15 projects across the Finger Lakes. Here's a list of them. I won't read through all those, but this is exciting. This gives new opportunities, particularly to our farmers who have the land, who are looking to generate more revenue when they've had a tough year. And we think that that's going to be very good for the local economy. Also, we want to ensure that we make sure that people have opportunities. For people who've lost their jobs or are in jobs that are being replaced through technology. Let's continue investing in online trainings through SUNY, give them opportunities to try a whole new career path. Another issue that's been big we found was kids being educated at home. I mean, how crazy did we think that would be a year ago, that they'd still be out of classrooms in much of the state? Families that are working from home, or you're trying to apply for your unemployment online, you're trying to apply for student loans online. If you don't have high-speed broadband, it becomes an impossibility. In too many areas of upstate, if you look at a map, it looks like they're covered, except if it's unaffordable for families, it may not be there. It may as well not be there at all. So we're going to be saying that for low-income families, they shouldn't pay more than $15 a month for internet service. And that is going to be transformative for those families and the businesses that need that. Healthcare premiums, something you shouldn't have to worry about during a pandemic, particularly. So we're going to eliminate that for lower income individuals, about 400,000 New Yorkers. I'm guaranteed there'll be people in Genesee County who will take advantage of that. Also, we found that during the pandemic, a lot of people, like if an employer cut back the hours or a restaurant was only open 25% capacity, there are people who could work part-time, but then they couldn't collect their unemployment insurance. And it became really tough for employers to get people to come back to work and for people to address this challenge. So we eliminated the rule that punished people who basically said, if you're gonna work at all, you don't get unemployment. So we structured a way to make sure that they're not penalized. Access to childcare. This is something that was a crisis before, and now it's a crisis on steroids with children at home. Parents not able to count on the ability to know their kids are safe and secure, from 9 o'clock in the morning to 3 in the afternoon. This has driven a lot of parents home. 99% of parents, I believe, are women, and we have to address this in order to get them back to work. And we're going to be addressing this with money for facilities themselves, encourage tax credits for employers, and also direct pay to parents. We're also realizing there's a huge problem with mental illness, which has been there, but COVID has really exacerbated people's mental health challenges, whether it's turning to substance abuse, alcohol, whether it's just dealing with the severe mental illness because you've been isolated and have not been able to see someone you otherwise would have visited to help you address your challenges. So we don't want to have a situation where people are heading into jails because they've had these problems. If they simply need mental health facilities, we're going to have destabilization centers for that. Nourish New York, really, really pleased that we're adding more money to this program. This has been an amazing lifeline for our upstate farmers in particular. Again, I mentioned my visit to the Noble Farms this summer, and clearly the cheese and dairy they produced didn't have an outlet anymore. They didn't have people buying it. And so it's genius to be able to pay farmers to keep their production up. We buy it and we are able to give it to the countless food banks that have had to be set up in every corner of the state because people just literally did not have enough food on their table. And for the first time ever, so many families had to really just suck it up and do something they never thought they would do, and just get in their car or walk to a facility and literally take a box of food so they could take care of their families that night. Nourish New York really helped make that happen, but also helped our farmers that were in need. Another problem that became even worse during this pandemic was domestic violence and gender-based violence. Think about people in volatile situations who are now under orders to stay at home. You can't go to work, you can't get a break, you can't go to your job. And we've had a huge increase in the number of calls to our domestic violence hotline. And it's been a real bad crisis for people, even in rural areas, who just don't have anywhere to turn. So for many people, they can't leave their abuser because they're trapped in the house. They don't have money to be able to leave. And so we're going to require abusers to pay for their housing and moving expenses, and close the gun loophole that allows abusers to buy a weapon with the domestic violence, creating a new domestic violence misdemeanor and having an office to address this. Also making sure that our police departments are working closely with the community to have a way to strengthen relationships, which we think is really important. That is due on the 1st of April. Before winning elections, it was quite a phenomenal experience for our boards of elections to all of a sudden deal with this. In addition to COVID, they did a phenomenal job. I have to tell you, everybody at the Board of Elections in Genesee County and elsewhere really stepped up to this. And we realized that there's some things that need to happen, which is speed up the vote counting for absentee ballots that come in. The early voting, next time, let's have longer hours. Let's have more no excuse absentee voting. This worked very well, particularly for seniors and people who are afraid to go out of their house on election day. It was amazing what we were able to accomplish with this, and also extend the time to request of absentee ballot. So that's a lot of material for you to absorb, very diverse areas to address, but I wanted to make sure that you at least heard it from me and had a chance to understand what we're pursuing in this year's budget, which the legislature will be reviewing or is reviewing as we speak. We anticipate it'll be on time, as we have been for many years under our administration. It's really important. I remember as a local official a long time ago, just waiting sometimes till May, June, July, waiting for the state legislature to finish their budget. And under the Cuomo administration, we've been laser focused on making sure that we don't leave local governments and counties in limbo, that we get them a definitive answer so they can do their budgets. So as we've seen, when people, things are at their worst, New Yorkers really showed their best, and we will win this war. We'll be focused together and reimagining, rebuilding, and renewing New York State. And I'm very excited about the opportunities. Let's see. Very optimistic about the opportunities that have presented themselves to Genesee County, and I look forward to coming back many more times for groundbreakings and ribbon cuttings and hopefully really exciting announcements about new businesses coming into the area. And again, I commend all of you. You're like the little engine that could. You're kind of wedged in between two larger metro areas, and you really punch beyond your weight, I'd have to say, because you really, Genesee County and in your anchor community, Batavia, but all the communities really have used your resources in such a smart way and made sure that businesses knew you're out there, and you've attracted businesses that I would not have expected an area like yours could do, except I know the people behind the scenes. And the legislators and Shelley Stein, thank you for the work you do, and to everyone involved, from Steve to Rebecca to Tom, everybody. You just really pull together in a cohesive way that I don't see everywhere. And as a result of that, you have been phenomenally successful for the people of your community. So look forward to seeing you all soon. I've got to jump to another one of these calls with what voice I have left. I hope it wasn't too scratchy for you, but I consider you all my friends. And again, let's just hang in there together. We will get through this. Thank you.